Exercise and sports participation is a double-edged sword. You know, we do have a number of children that are obese in our society, and we want to get those children involved in physical activity and getting outside. And yet you can have too much of a good thing in this situation. You can have children that are participating too much, and that's where they begin to get breakdown of their bones, their ligaments, and their tendons, and that's where they get overuse conditions. My advice for children and parents that want to avoid overuse conditions would be a number of things. Now, the first thing just has to do with the volume of the exercise or the activity they're doing. The second would be the intensity. Now, in terms of volume, children, their tissues need to recover. And what will happen is if they're involved in an activity that stresses their bones, their ligaments, their tendons every day, they don't have time to heal. They don't have time to overcome the stresses. So first thing would be maybe participation 5 days out of 7 and having 2 days worth of rest per week when children are not involved in the sport. That's probably the most important thing. But the other thing that's important is in the sports participation. Children, just like adults, need to warm up before they participate. You can't just go out and start running or start playing soccer. There needs to be a very aggressive warm-up period when children regain their flexibility, when their bodies are now ready to function. The second thing is stretching, and stretching usually should be part of the warm-up. And finally, equipment is very important. Even in practices, children should have proper equipment. If they show up for a soccer practice with a poor pair of tennis shoes or without shin guards, they shouldn't be permitted to practice. So that's very important. So the sex ratio of children that are coming in to see me for overuse syndromes is definitely changing. I am seeing more girls than boys, and certainly for many sports-related injuries like anterior cruciate ligament tears, girls are like 3 times more common, particularly in my practice, than boys. But that's across the board. But it's also true for overuse injuries, and particularly overuse injuries in adolescent females. That can be a particular problem. Girls are at much greater risk than boys for non-contact ACL tears. For instance, a girl will be running down the field, she'll plant her foot, twist to go after a ball, hear a pop, and blow out her ACL, just like that. That's a much more common situation for females than males. Males have ACL tears, but it's more often in contact, such as being clipped in football. So for females playing soccer, even things like badminton, basketball, non-contact anterior cruciate ligament tears, it's an absolute epidemic. The long-term effect of an overuse injury may not be that bad. The good thing about an overuse injury is you start to have pain, and the pain can restrict the activity. That's why when I see an overuse injury, I don't recommend anti-inflammatory medication or pain medication, because I want the symptom to limit the activity. And if you can prevent things like stress fractures and avulsion fractures, that's a good thing. For preseason conditioning, there's some things that are just good for all children and all sports. And one of those things is flexibility of the hamstrings. And stretching hamstrings can be a real drag. I know I don't like it, and I know it can be just no fun to do, but it's very, very important, because hamstring strains are one of the most common conditions that children and adolescents can have injuries. So stretching of hamstrings. Now the second thing is strengthening and toning. Strengthening and toning of the abdominal muscles and the gluteal muscles also is very, very good. Good, strong abdominal muscles can protect the back. And gluteal muscles also are good for protecting the back. So if I had to come up with a general prescription for all sports, be they endurance sports, strength sports, it would be flexible hamstrings, strong abdominals, and strong gluteal muscles.